Hey guys, I wanted to jump on the live just because that seems easier these days. But I had a messenger question from someone that I really thought was a good one and that probably a lot of other people had questions on. And so, hold on a second, there we go. So I wanted to explain kind of, so this person's 2 months out from surgery and they're only able to eat 3 to 6 bites at a meal, and they get that either fullness or restriction, or maybe they're just kind of done with whatever the taste is or the texture. That's completely fine. That's very normal to really have sort of a low threshold for the amount of something that you can really tolerate, or you just kind of take 3 or 4 bites of something and maybe it tastes good the first couple bites, and then after that you're just kind of like, yeah, all right, I'm done. That's completely fine, completely normal. The time frame for that lasting just kind of depends. For some people, they never have that. For some people, it might be 6 months of that. For some people, it might be closer to a year or so. I would say pretty rarely is it that someone's a year out from surgery and they're still having a difficult time eating more than like a half a cup of food at one meal. But if you are in that camp where maybe you have this little plate of your meat and your veggies or whatever it is, and you get a few bites in and then you're kind of like, all right, I'm done. This is where your protein shakes or your high protein smoothies comes into play, and why I think it's really important to count the grams of protein that you're getting those first few months. So you kind of have an idea of where you are. So, let's say it's lunchtime and you had, maybe 3 or 4 bites of tuna salad and maybe, a couple bites of some, steamed broccoli or whatever it is. And after that, you're kind of like, ugh, all right, I'm done. I feel full, or I just don't want any more. Again, that's fine. Don't push yourself. Once you feel any kind of restriction, or sometimes it's more of like a tightness, you might not be necessarily sure what you're feeling, but if something's just kind of like telling you like, I don't know if I'm full or not, that's usually a good place to just kind of stop and to take like a 5-minute breather. And then if you decide, yes, I'm done, I don't want to eat anymore, what you want to figure out then is that the next time you're ready to eat, so probably anywhere from 2 to 4 hours from then, instead of having a more solid meal, what you'll probably want to do is have one of those high protein shakes or one of the high protein smoothies. And this is because you'll get more protein and kind of a concentrated source with those. If you do the smoothies especially, you can add some fresh or frozen vegetables, maybe some frozen fruits or fruits too, and blend them. And then you also get the fiber, the antioxidants, and the vitamins and minerals that are in whatever fruits and veggies that you add. But that kind of does double duty because you're getting your fluids, you're getting your protein, and you're getting fiber. So just kind of keeping track so that okay, I had lunch, I had 2 or 3 tablespoons of tuna salad, which was, maybe an ounce, maybe an ounce and a half. So an ounce of meat has about 7 grams of protein typically, whether it's fish, beef, chicken, poultry, whatever. So you can kind of just get an idea. It doesn't back to science, but you want to have a rough estimate of where you are. And then okay, at my next meal or when I'm next scheduled to drink something, I want to try to get, probably 10 to 15 grams. And again, that's where those high protein shakes or smoothies come into play. The further you get out, you'll be able to have a little bit more in regards to volume of food. That's okay. A lot of people start to freak out when they can reach maybe, half to 3/4 of a cup to a cup of food. That's okay. We're not trying to starve you to weight loss. Obviously, you do want to have smaller portions because typically less calories does lead to more weight loss. But we also want to fuel your body, right? We're not trying to starve your cells and malnourish you. And so that's where you also need to kind of balance that with having those higher protein shakes and smoothies. But then so when you do get to those larger volumes of food, you really want to be especially careful about making sure that you're really having the highest quality foods. So lean meats and proteins or heart-healthy fats, lots of non-starchy vegetables, those are really going to be kind of the mainstay of your meal, right? If you think about the old food guide pyramid, those should be the bottom instead of the grains. So you want to focus on those. So anyways, I'll leave it at that. I don't want to be on here too long, but just kind of wanted to give you a little bit of guidance with that and sort of when to use those shakes and smoothies. I'm not a huge fan of having, 2, 3, well, 2 is fine, but maybe 3, 4 plus, shakes a day. I think that can really take away from more of those whole foods that your body needs. If you're getting all your nutrition from something that's literally sitting in a can on a shelf for weeks or months at a time, that tells me there's not, live organisms in there, right? There's not those antioxidants, those phytonutrients. Yes, they might have pumped some vitamins in it, but it's different from adding maybe a frozen banana or some, beets that you roasted or whatnot. So play with it a little bit. I know people get really kind of overwhelmed or nervous when I say adding vegetables to a smoothie. You don't have to add a lot. Spinach, beets, believe it or not, frozen cauliflower or even like a quickly steamed cauliflower. Again, you don't have to add a lot. It's really mild in taste and you usually don't taste it. Don't add a ton of it. Carrots are really great. Squashes are really great, like a butternut or zucchini. So just kind of play with it a little bit. But anyways, that's why I'm not a huge fan of having like 3 or plus sort of pre-made shakes in your diet, because you really do miss out on those truly like live nutrients that your body needs. So, all right, hope you are able to understand that. I kind of covered a couple different topics there. If you have any questions, just post them in the comment section below and I will answer them. Thanks.